Hi and welcome. I'm Dr. Frank Liberti, and welcome to another one of my vodcasts I call Personal Injury Hidden Gems. You know, they have said that data is the most valuable commodity. Well, if that's the case today, you are going to be in for a lot of vital data. I want to get started right away. So today's topic is how operating at best practice opens an unprecedented new line of attorney referrals. And if you want to stay till the end, I'll share a recent testimonial. Now, these are vodcasts, video productions, podcasts or audio, and I do 12 or 15 of these a week. They're for your knowledge, for your education. But if you find these seminar snippets useful and you would like more, then I invite you to register online to attend my full weekend seminar presentation. These are just snippets from the seminar. So you can go online at accidentworks.com, click on the physician portal, then click on seminars and get the dates of the locations, and I hope to see you at a seminar location near you. So this is about best practice, and man, this is a lot of information, so hold on here. Let's start with performance. I'm going to briefly tell you that you can perform the 99203 or 99204 Medicare level exam, or you could move up to the higher injury model exam, the bodily injury exam. If you were to look in the Medicare manual, Chapter 12, it defines different types and different levels of exams. Well, 99203 and 99204 is actually an initial preventive physical exam by Medicare. And a bodily injury requires a higher level exam. So when we talk about performance, talk about doing a bodily injury assessment. All right, next we talk about competence. There's two areas of competence. One clinical, one you could say administration/marketing. So this is not about marketing here. This podcast is about best practice, and we're going to stick mostly with the clinical sides of it, including that 1191M through the 1199M level injury model or bodily injury exam. Next is knowledge, and we just said that data is your most valuable commodity. So I will encourage you to get all the knowledge you can from all the sources you can. There are many sources for knowledge in personal injury, other consultants, other seminars, and there's mine. And so take them all, get all the knowledge you can get. Then there's branding, and we brand strategically, and we look at positional mapping and conceptual analysis. These are branding concepts that actually have been overlooked, not just by the chiropractic profession, but by many small service provider sectors. And I can tell you that there are 4 factors on a positional map. You're on the map. Depending upon those 4 factors will determine where you are on that map. And then there is a conceptual analysis, and that's the viewpoint that attorneys hold when they compare you to your competitors in your community. So when we talk about branding, we use conceptual analysis and positional mapping. You probably learn them on another vodcast, but we'll teach it at the seminar. Then there's vision. Now, not having met you or spoken with you, I don't know what your vision is. We use a form called the MONSTA form, MONSTA, stands for monthly statistics, where you get to tell me where you're at, where you want to be, what your goals are, and then we plug into different programs to get you there. But without having met you, I can only say that when I look at this vision, part of best practice in your vision, it reminds me of goals and dreaming. And in the Bible, it says, where there are no dreams, the people perish. And I was in church not too long ago where our pastor referred us to a book called Atomic Habits by author James Clear. And in that book, it says, we do not rise to the level of our dreams. We do not rise to the level of our goals. We fall to the level of our systems. And nothing could be more apropos in personal injury than where your business development system is. You know, up to 60% of your actions daily are based upon habits, and the other 40 come from learning something new. Well, you can't learn something new if you don't get out into new areas of knowledge. And if you base your practice and your business on your own model and you don't look at other models, you can't get to higher levels. So that's the vision component. Then we have development, and we're all about business development, and we develop clinical, administrative, and marketing components of the practice and the business. UVP stands for Unique Value Proposition. You'll learn that at our seminars. I can tell you that there are 3 components to a unique value proposition. If you've got all 3, you absolutely will have more business. And then lastly, there's experience. Now, I've got over 40 years of experience in personal injury, but I had a tremendous experience that I think probably I'm the only chiropractor that's ever had. And that was that I set precedent at a state Supreme Court level on an Unfair Claims Settlement Practice Act. That was back when they were using 3rd edition guide. I helped create table formatting, another topic that we'll introduce on a vodcast. And I can only tell you that I hope that my experience is going to help many of you to use my experience, my knowledge, my influence, maybe even my capital to help you do more within the next year than you could do by yourself. And that's what this is all about. So let's get started. And let me explain to you what best practice is, what the role of evidence-based practice is, and the definition for EBP, evidence-based practice in personal injury. And it is the integration of the best research evidence with clinical core competence and patient assessment to facilitate clinical medical decision making. So you use evidence-based practice to improve quality assessment, standards, and patient care. Stay with me. Evidence-based practice needs to be supported by strong research. A CDSS, clinical decision support system, results in improved outcomes, but it requires you to show in your medical records statements of undisputed facts, memorandum of points, declarations, and authorities. So we're going to cite at least 72 authorities, administrative and judicial rulings and hearings to show you how you can present evidence-based practice to reduce variation and show your standards of how your evidence-based and medical parameters are being met. So, people and lawyers especially want the best doctor. So at our seminar, we divide the concept of best practice into clinical innovations and business development. These are doctors in training. We want you to learn more than you knew coming to the event. And I want you to earn more income, and I want you to save more time to do the other things in life you enjoy and just continue to be awesome. So let's take a look at what really constitutes best practice in medicine. And I'm going to start with evidence-based practice. And I want to tell you what that means. You're familiar with Colossus and the 79 other softwares that the insurers developed that are just like Colossus, but you may not be familiar with BPI, stands for Business Process Index. Also sometimes referred to as business process improvement because the insurance companies created it to improve their bottom line. It is a cost containment tool used to deny, to dispute, to delay your findings and your claim factors. So what is evidence-based practice? I'll tell you what it is. It's going to be difficult. Watch. It's when you take the diagnosis and convert it into an impairment. And when you put the impairment into a table called table formatting, and when the table tells you what AMA guide was used, what AMA guide edition, chapter, table, page, and formula was used to arrive at the impairment for that body part, then it wants you to list the loss of function for that body part. And they want you to use the International Classification of Functioning, Disability, and Health Guidelines. I realize that's a mouthful. I'll show you a table format, if not in this presentation, in another vodcast called Table Formatting. If you know who Aaron Deshaw is, chiropractor and lawyer and Colossus expert, he says that we're in the dark about table formatting. He says most don't have a clue, but you have to submit findings in table formatting. Also, if you don't put your impairments in table formatting, it doesn't have to be admitted by the insurance company, so you lose the value for the impairments. I'm talking about evidence-based practice. I don't think you've been exposed to this, and that's why I teach it at my seminars. So if you're watching this, it's here to help you to decide, should you attend this seminar? Now, once again, diagnosis should convert into an impairment. The impairment should be put into a table. The table should show the body part that's affected. Then it should show the loss of function and the degree of impairment. And it should cite AMA guides by chapter, edition, page, formula. And it should show International Classification of Functioning, edition, guide, chapter, table, page, and formula. Now, here's the good news. We've got a quick tool that we use that assembles all that information within seconds. Now, you don't have to change your electronic health record system or your EMR or your EHR. We've got systems that actually will add on, make life simpler, save you a lot of time. The next area of best practice starts with your concierge intake, injury, or triage questionnaire. Now, I'm talking about going far beyond duties under duress, loss of enjoyment, and ADLs. When you take on an intake injury questionnaire, you've got to use triage for all the threshold injuries. Now, if that's a new word for you, injury thresholds, another reason to come to the seminar and watch another vodcast, because there's 13 main injury thresholds and up to 600 different types of injuries that can be seen in even a low collision auto accident. So we have a concierge injury intake questionnaire. In fact, you can email it to the patient. They can fill it up before they even get there. And we're going to look at the injury thresholds. Stay with me. The next couple slides, I'll show you what those threshold injuries are. But there's hundreds of questions that need to be asked in order for you to surface these thresholds. That's why we created the concierge intake injury triage questionnaire. Now, you can email it, and if the patient fills it out online and clicks it, it'll automatically come in, and using our system, it'll dump right into your SOAP notes. And it'll put it in the right language, format, and sequence, and it'll make diagnoses for you. It'll create the table for you. I'm talking about some tools that really take you to the next level and save you time. Next, it talks about exam level abilities. You know, in the Medicare manual, we know that there's a disability exam or a Social Security exam, a workers' compensation, Medicare, personal injury or bodily injury and impairment, and also life care assessment. So there's more than one level. We want to teach you the higher levels that are going to surface more injury thresholds, that are going to interface easier, add more value. Then it comes to diagnostic abilities. They're very simple. We're just going to take a look at if you're using, for example, a pinwheel, that's not admissible evidence to prove a sensory impairment, but monofilaments are. So we're going to teach you monofilaments. They're very inexpensive. We're going to teach you NCV, which almost every chiropractor in every state except for 2 can perform, because the most unequivocal evidence, according to AMA, for establishing sensory motor is NCV above EMG, and our license doesn't allow us to do EMG. So when it talks about diagnostic abilities, are you sending your x-rays out for radiographic analysis for AOMSI? Are you taking the appropriate x-ray to show uncinate process fracture? Are you using the questionnaires to show the 4 different types of mild traumatic brain injuries? Are you seeking out in your diagnostic testing for vertebral-based nerve insufficiency, cervical chain ganglia injuries, even the post-traumatic stress syndromes, anxiety and sleep disorder? What are you using to diagnose? You're doing electronic muscle testing. So we're going to look at all that. Then there's the injury severity threshold understanding, and I think in a couple of slides I'll show you what the threshold injuries are. Then there's determining functional losses. You do have to take the diagnosis, convert it into an impairment, and then convert it into a functional loss. Part of that comes from your intake questionnaire. Part of it comes from your exam level. And then there's impairment rating guidelines, and that means you've got to do a whole person impairment, a regional impairment, a spine impairment, put those impairments into the diagnostic-related estimate categories, diagnostic-based injury severity types, to recognize the trauma lines and the thresholds. Then there's the outcome assessments. And that means making each body part should have its own diagnoses, its own prognoses, its own MMI, and should be labeled static or stable in your outcome. So I know you're not doing that now. Medical decision-making abilities. You know, there's up to 600 medical decisions are being made by the insurer softwares. And, you know, you have to know what they are and be able to match them. I don't expect you to do that by yourself. So use our tool, which will help you to make medical decisions and determinations so that you can actually exchange complex data, interface it into the insurer's software, and bring about added valuation. Then we talk about medical validation. This is the process of IMV, independent medical validation, to override independent medical examination. So I am going to teach you at my seminar how to perform IMV to override IME. You will eliminate the adjuster's opinions, the supervisor's opinions, and the IME doctor's opinion. And then there's, to do that, you must establish the preponderance, the next item on our list. So your evidence has to preponderate over the adjuster, the IME, and the other doctors. And you have to show by greater degree of believability that you've got more evidence on your side. And that's how you win what's called the greater weight of the evidence challenges. Now, what do you think injured bodily injury patients need? Well, they need something in their intake injury questionnaire, in their triage assessment, in their exam assessment, and in their treatment protocols. So we want to look at all of that. What do you think lawyers need? They need their problem solved. And, you know, if you can be the problem solver, T. Harv Eckert says, motivational speaker, he says, If you want to be rich, give people what they need and want. But if you want to be wealthy, find out what people need, what their problems are, and fix their problems. So to be rich, find out what they need and want, give it to them. But to be wealthy, find their problems and fix them. And we know what the problems of personal injury are, and I'm here to show you how to fix them so you can get the referral business. Now, what factors determine whom lawyers refer to? Waiting to hear those at my seminar. What are the different levels of injury model assessments? Well, there's 5. What are the different evidence-based practice skill levels of injury examiners? And there's several. How many diagnoses are required in a Colossus claim? A minimum of 10. How many sections should there be in a bodily injury claim assessment? You answer that question right now. How many sections should there be in a bodily injury claim assessment? How many sections are in your notes, your SOAP notes, your EHR, your EMR system? You know how many sections there are in a Colossus claim, in an insurance software bodily injury claim? Minimum of 24 sections. And guess what? You're responsible for between 17 and 20 sections of a bodily injury claim, and they should be identified by numbers. So you should have all of them listed, or you won't exchange complex data. You won't get more value, and you'll be subject to more disputes. How many decision points are there? What is a decision point? What is a case maximizer? What is a prolonged modifier? There's 58 case maximizers. If you don't know what they are, you need to come to the seminar. I don't want to scare you, but there are 67,880 decision points. 67,880 decision points. If you're using a Medicare assessment or an EHR, EMR based on Center for Medicare Service Guidelines, you're missing about 80% of the decision points. Okay. So we're also looking, when we talk about best practices, what is the perceptual map? How does it relate to you and your business within your medical legal community? Well, once again, there are 4 factors that comprise the perceptual map or positional map. What position you hold in your community. 4 factors. And we're going to show you how to assess those 4 factors and where you stand at the seminar, and then how to get you to the center of the positional map so you have top of mind awareness. Now, there's another thing called conceptual analysis, and that's what the attorneys think of you, how they compare you to your competitors. And believe me, there's a method they use to compare you. So I want you to be the top of mind awareness when it comes to personal injury. And the next is, how many medical determinations does Colossus make in a bodily injury claim? 600. How many can you make? What are the 3 differences in core competency needed to take referrals away from competitors that we teach on Sunday of the seminar? Are you ready truly for a business development plan specifically designed for personal injury, for chiropractic, that could be applied to your small healthcare provider business? Then come to this event. What is your own personal injury business development plan? Now, there's 5 W's. Like what, when, who, where, why. So my question is, why should somebody go to you over a competitor? Why should a lawyer refer to you? Why should you be called upon? Can you fix the problems of personal injury? What can you do that others can't do? Who has the greatest core competence among all the peers in your community? All right, let's talk about the serious threshold injuries. What are they? Why are they overlooked? And at my seminar, you'll be certified in the injury severity threshold. How does certification in the injury severity thresholds, in the injury model exam, as an independent medical validator, build your PI practice? Please attend this seminar and find out. But let's talk about a few threshold injuries. The first is AOMSI, alteration of motion segment integrity. I'm not going to teach it here, but 65% of all accident victims have it. And of the accident victims that go to doctors, 82% have it. It is the number 2 rated injury that someone can acquire in a vehicular collision at low speed. The number 1 injury is an injury that is life-threatening and requires surgery, but this is the second highest injury. It's rated by the AMA the same as an impairment of a foot. It's given a 25% whole person impairment. It's rated the same as surgical spinal fusion of 2 vertebrae. It's the first threshold injury you should look at. Then there's uncinate process fracture. I want to tell you that there are oblique GForces. If your head is turned while you're struck, if you're hit from the side, if the car spin, oblique insults are transmitted to the upward lateral projection of the vertebrae called the uncinate process. They cannot handle more than 35-degree lateral bend on impact force, and the upward lateral projection will fracture. It is a minimal derangement fracture. It's worth the full policy coverage limit It's overlooked by almost everybody for two reasons. One, it takes 2 months to show, and two, you need a special x-ray that few people know how to take. That fourth threshold injury are the cervical chain ganglia. There's 7 chain ganglia in the cervical spine. They lie very close to the vertebrae. They're embedded within 7 muscles. When the vertebrae shifts or moves or becomes unstable, as they will in AOMSI, they press on the cervical chain ganglia, producing about 172 different symptoms that you can diagnose. You need to look at cervical chain ganglia. They have to be assessed, and I don't think that many people are doing that now. If your head is extended and rotates, 30% of all people with head extension and rotation experience vertebral basilar insufficiency. I need to go over that with you, and the difference between vertebral basilar insufficiency and mild traumatic brain injuries. There are 4 types of mild traumatic brain injuries and 1 cerebral contusion, and 99.99% of everyone in a low speed is going to have one form of mild traumatic brain injury. Now, the number one cause of PTSD is no longer war, it's now auto accident, but we also have subcategories known as post-traumatic stress syndrome, and we want to cover those threshold injuries. Now, let's take AOMSI. Ligament is stretched or torn. Before you can tear the ligament, you've got to tear the tendon. Before you tear the tendon, you got to overstretch the muscle. Before you overstretch the muscle, you have to damage the dense connective tissue and the collagen fibers. So when you damage dense connective tissue and collagen fibers, that has to be diagnosed. Then the muscle injury has to be diagnosed. Then the tendon injury, then the ligament injury. But because you can't tear a ligament if you haven't damaged a tendon and a muscle and the tissue that surrounds the muscle. And then the muscles surround nerves, so you got nerve tissue. And there's a new MRI that will show the damage to the muscle cells, the tissue morphology, goes a long way to explaining the damage to the muscle, and you can even palpate it. So we cover that threshold injury. It's important to understand the difference between chronic pain syndromes at 3 months and 6 months post-accident, and G codes for neuropathic pain and neurogenic pain. So we cover that topic. Facets. Many people missed facets, and many people failed to measure the canal side, so they missed foraminal encroachment and stenosis. They add tremendous value to the claim. The capsular ligament, when that capsular ligament is damaged, the prognosis changes, the future medical care changes, and most people aren't identifying it because there are 7 ligaments in the spine. And when the articular facet is elongated, you've got a whole new set of static and stable conditions. It's going to change the MMI, the prognosis, the diagnosis, and we want to cover the different facet syndrome and canal side injuries. Of course, we're going to cover the disc. And the last one, I want you to see and know and understand how easy and simple it is to do an NCV. You can buy those things used online for $1,000. In every state except 2, a chiropractor can perform the test. In those 2 states, you can take a certification course for 12 hours. The AMA calls it the most unequivocal test for sensory and motor impairment. But you can also do monofilaments and muscle testing. You can also do EMG. Then we want to go over monofilaments, electronic muscle testing, the diagnostic radiographic mensuration analysis procedures so you can see AOMSI, and then how to become an IMV, independent medical validator. That's what the certification's in at my program. Now, what causes AOMSI? Simple answer is severe trauma. It's a macro injury. It only occurs at severe trauma. It produces spine instability. Spine instability from AOMSI occurs when the elastic strength of the ligament stretches to such an extent that it cannot return to its original shape. It is permanent. Now, this is an internal disruption or tearing of the ligament tissue, and it is permanent. 25% whole person, permanent impairment. Just as rated the same as an amputation of a foot and surgical fusion of 2 spinal vertebrae. That's a big injury because 65% of all people have it. And there's a case set aside, settlement evaluation of $66,000. But you're not going to be able to convey to your lawyer how they can get $66,000 for that injury if you don't do evidence-based practice. So we, therefore, will provide you with a set of exhibits containing all the evidence-based practice to give to the attorney when you diagnose that injury, including an animation of the vertebrae pushing on the chain ganglia. Unbelievable. You've got to come and see this. Now, I like to talk about the truth because they say they don't always tell you the truth in PI. When I go all out and do it, well, the truth, it's like a lion. You don't have to defend it, let it loose. It'll defend itself with evidence-based practice. So let's just go to a quickie premise. During a sudden rear end impact, the vertebrae are suddenly accelerated and decelerated within that first 1/10 of a millisecond. So one of the things we talked about earlier was when the head is rotated, when the head goes back and rotates, and when there's oblique G-forces. Well, when the head is rotated backwards and extended during impact, the amount of ligament strain on the joint capsule, including that capsular ligament, increases by 50 to 200%. So what happens when there's extension and rotation and you get 50 to 200% more joint capsular ligament strain? You're going to need to come and learn all that. But the physician's got to investigate all the different G-forces that act upon the spine, starting with the direction and the degree of the force. Is it left? Is it right? Is it oblique? You know, when you suffer mild traumatic brain injury, that head can go forward or backward, left or right, but it also can twist and turn. You could have a right side or left sided brain hits, front or back. I mean, these is the direction and the degree of force, along with the degree of acceleration and deceleration, are going to show us different types of injuries, both the ligaments, muscles, and the brain. And with translation, angular motion, and rotational forces, you'll see different AOMSI injuries, different injuries to the vertebrae. So all that's got to be closely looked at. Now, this seminar is not about collision and compression coefficients. It is about clinical core competency, a little administrative, and then a lot of strategic branding core competency. And so, but you got to look at flexion and extension, oblique and rotational forces, because they all act upon the spine differently. You have to be able to diagnose thresholds. You have to place these injuries into impairments and DRE categories. So we're going to diagnose collagen tissue injuries, dense connective tissue injuries, muscle injury, tendon injuries, ligament injuries. Everyone's got a different diagnosis. Onset process fracture, discs, nerves. I want you to look at G codes, neuropathic pain. I want you to look at vertebral artery crimping, cervical chain ganglia injuries, mild traumatic brain injuries, post-traumatic stress syndrome, and morphological tissue damage. This is a copy of the X-ray analysis form we use. I put a red circle around it. On the bottom right, it says translation and angular motion, both at the level of vertebral level and by millimeters and by degrees, and then the AOMSI by level and degree. So you're going to want to look at X-rays according to angular motion and translation, which is traumatically induced and possessed against adjacent vertebrae. Then you put it in the DRE category. So this is showing you how easy it is to use our tool and get into the DRE category that's appropriate. If it's radiculopathy and you can find it at the time of the initial visit, you're DRE category 3. If it's loss of motion segment integrity, you're DRE category 4. What if you have multiple level disc assessed by MRI? Then you could be a DRE category 4. Not only do we go over this, but we give you a tool that'll do it for you so you don't have to spend your time. You have to make evidentiary conclusions. So, for example, in this one, let's take a look. It said diagnostic testing of radiographic mensuration adhering to AMA guide was used to establish the presence of AOMSI in this patient. According to a former superintendent of insurance at Allstate, James Mathis, a diagnosis of AOMSI carries a case settlement reserve value of $66,000. I want you to be able to give their findings to the attorney so that they can get that $66,000. And that means evidence-based practice, specific language, and it also means exhibits. And to my knowledge, we're the only ones producing those exhibits and even animated exhibits. So what is best practice? It's complete business development. It includes investigating and diagnosing injury severity threshold, using the 1191M injury model to do the bodily injury model instead of the 99204 Medicare exam, operating at evidence-based practice, table formatting, showing what body parts are injured. Did they derive or convert into an impairment, or do they produce loss of function? What guides can you show me? What chapter, table, page, and formula? Now, I have another vodcast called The 4 Corners and 24 Sections of a Personal Injury Claim. I told you there were 24 sections of a claim, and there were also 4 corners. So we teach that at the seminar and also on another vodcast. I want to teach you what the decision points are. If you don't know what they are, you can't include them. Every decision point conveys a dollar valuation. There's a formula that the insurers use. It's called the decision point to dollar translation percentage multiplier formula. Now, decision points translate into a dollar based on each insurer's rate and formula. If you don't know what the decision point formula is, and if you don't know what the decision points are, there's nothing for the insurers to convert into a dollar. So please come and learn the decision points and how to include them in your assessment. And there's another vodcast called the decision point formula. Then we have business process index. I want you to know it. There are there are 4 components to it. I have a 2-part series on business process index. One of them's online now, and it covers the first 2, and the other one covers the 3rd and the 4th. And then we have best practice that will bring you strategic branding and unique value proposition, because you will have what's needed and wanted. You will have what will fix problems. You will have something others don't have. And then it's just a matter of educating the consumers in your community, and that be direct public and attorneys, that you're the best. That's what being best practice is about. Now, being in a personal injury chiropractor right now is awesome and rewarding. I think we're at the best time in history. Now, I've been doing this since the late 70s, so I think now is the much better time. Everyone's aware of auto accidents. You don't have half the problem. Back then, we weren't being paid for modalities. People didn't even want to get modalities. Chiropractors didn't even want to buy them or use them. Now, everybody's pretty much up to snuff. You just take this best practice and you become better than everybody else. And that's awesome. We're the best to treat personal injury to begin with, but now I want you to be the best to command top of mind awareness and referral. Now, if you are the one who exhibits best practice, you're going to have the unique value proposition to advance your business over competitors. When you come to the seminar on Sunday, we're going to plug in a form, and I'm going to tell you exactly how many bodily injury patients you have in your community every month who get into an accident and go to a doctor. We have a formula. We have a couple of websites where we can tell you exactly. And all I want you to do is to increase your market share by 0.05% of the business that already occurs and exists in your demographic every month. That 0.05% translates to $30,000 to $50,000 a month additional. I've got guys coming to me doing 3.5 and 4 million a year that add another 7 figures, and I've got people that come in at 100,000 that double and triple their business within months. So it works no matter what level you're at. Check out our seminar dates and our locations and the syllabus at accidentworks.com. Because if you're not using this material, I promise you're losing $10, $20, $30, $50, up to $70,000 a month. You're losing up to $70,000, $50,000, $30,000 a month. Go to the website, accidentworks.com. Simple. Register for a seminar location nearest you. Now, you see there's a sample of one of the seminars. I usually rent the boardrooms at the hotels, which have 20 seats, because I have so much information to deliver. I don't want larger crowds than that. But I'm so very confident that this is going to help you, that you can call me and I'll ask you a few questions. We'll talk about your situation. If it's not the right thing, I'm going to tell you. For example, if you haven't been in practice for 5 years, if you don't own your own practice, save this for other people to come. And if you only have one personal injury patient, maybe you want to take the other seminars first. Call me and I'll discuss it with you, or look at the syllabus. I don't know what goals you have and what you want, but if you want to be the best and command it, I'm going to show you how any chiropractor at my seminar can increase his personal injury business by 0.5%, which is 0.05% of the available business in your community. By using our strategies, you will get that. If you don't, you're losing $30,000 a month. Now, the last thing I wanted to say is, I'm so confident in this that here's what you do. You come to the seminar, you enjoy the weekend. If by the end of the day, Saturday, something doesn't seem right to you, you don't feel like this is going to help you, or that you don't want to implement it, please just tell Leela. You can see Leela in the blonde hair in that picture. She will refund your seminar fee, and everybody will be fine. You can't lose, and you're going to learn enough that you'll be glad you came, and you can walk away with the handouts. And if you're not happy, then keep the handouts, and what you learned, and Leela will refund your seminar fee. So that's pretty gracious. Now, there's the website, accidentworks.com. Go to the physician portal, and when you click on the physician portal, then you can click on seminars, and you'll get the dates and locations. I've got the whole year's dates planned out, but I know that in January we were in Nashville. In February we will be in Atlanta. In March I'll be in Orlando. In April I'll be in Utah. In May I'll be in Orange County. In June I'll be in San Francisco. I do have seminars July, August, September, October, November, December, but I haven't picked the locations yet. But you can go online, check the location, the dates that are going to work near you, and learn the importance and benefits of being best practice, creating a unique value proposition, and developing a strong personal brand that's going to make you so much better. It's going to be easy to tell others what you stand for. You should be able to get up there and say, look, when you use me, this is what you get. And those benefits should be so strong that others can't copy you and others don't have what you've got, and attorneys know they're going to lose out if they don't use you. It's an expanded clinical core competency is one area to start, but then creating an image and a reputation and repositioning you to get on that positional map in a new higher position closer to the center to attract attention to the direct public and to the plaintiffs' attorneys in your community, to cause attorneys to shift brands and refer to you over competitors. So I'm Dr. Frank Liberti. There's my number. There's my email address. We're at accidentworks.com. And when I say, let me see if I can't go back to, if we get cut off, thank you very much for being here. I want to stop the slide and see if I can't sign off. There you go. I want to say goodbye to you and thank you for being here. You know, I want to salute you for watching this, and it tells me that you're solution oriented. And if that's you, then you got to get to this seminar series and check it out. Not series, it's only a 1 weekend event. All right. Thanks for watching this podcast. I've got a lot of them. I've got a YouTube channel. I've got a podcast channel. I got a vodcast channel. And of course, I've got the seminar. I can't give it all to you in one vodcast, but I sure can during that weekend. I'm thirsty for this information. I mean, look at the books behind there. I mean, I try to buy and read 2 books a week. They say if you read 5 books a week in 3 years, you're an expert on that topic, or 3 books a week in 5 years, you're an expert in that topic. And so since 1979, that's what I've been doing. And I'm just so happy to be here. But my goal is to improve your personal injury business. So I hope to see you at a seminar where we can get down to business. I'm Dr. Liberti. Thanks for being here, and I'll see you soon.